marketing coordinator here at Northern Illinois Foot and Ankle Specialists. And today we have a special live stream Q&A with none other than Dr. Lovato. So while we wait for people to come on, just, and I know right now we don't have any questions yet, but Dr. Lovato, great to have you here this morning. Great that I want to thank you personally for taking time out of your day to do this. And really the thought process behind this video, as you know, was to just connect with our audience, connect with our patients in a new way that maybe that we haven't tried before. So, thanks, I need to leave, but I will give my question and look it up later. We already have a question.
First off, thank you, Ryan. Thanks for having me, and thanks for setting this up. I think it's great to, keep an open dialogue with people in this trying time. And unfortunately, people are stuck at home and are looking for some answers. So hopefully, we can give some of them.
Awesome. Well, Barbara MacArthur actually just popped in with a question. I put a little bit of it on screen. I have chemotherapy in my feet and am looking for the best walking shoes. I'm 71 and about 160. 71. So I don't know if that's a question that we want to necessarily answer live on air, but the question is there.
Sure. Yeah, I can give a kind of a broad answer. So what chemotherapy can sometimes do is it can cause peripheral neuropathy, which basically means that you can reduce the sensation to your extremities. It's most pronounced in the feet. It depends on how long you've had the chemotherapy. It doesn't happen to everybody, but if you do end up with some of that numbness, then it makes the most sense to find a shoe that's not going to have any pressure points, because obviously you can't feel it as much. So you almost treat those types of people as if they're a diabetic patient, for example. You hear about diabetic shoes and diabetic inserts and things like that. So those are some of the things we can do for some of our chemotherapy patients. But the most important thing, if you're not going for the insurance covered diabetic shoes, if you're just going to a shoe store or something like that, is just making sure that you don't have any pressure points. Getting somebody else to fit the shoes. We can do that in the office for you if you like. Basically just making sure that you're not going to have any irritations that can cause sores or wounds or problems later.
Awesome. Well, Barbara, I hope that was the answer that you were looking for this morning. So Dr. Lovato, right now, obviously, we're all in a very unique time. What are some of the things that you're seeing in the practice that we're doing in the practice as a whole to really address the current state of the world?
Certainly, it's a great question. There are a lot of businesses and people that the state and the federal government have listed as not essential, and they're stuck at home. We have been tasked with continuing to go and seeing patients. So the need to prevent our patients' exposure and our exposure is unique. I can tell you what the hospitals have been doing in the area, the advocates and the Northwesterns, and we're trying to model off of that. We get almost daily communication. I was just part of a live stream with some of the executives and the medical officers at the advocate system, and they were discussing the limited shortage of protective equipment and things like that. So basically what the hospitals have started doing, and we're mimicking it, is before you even enter the hospital, you get your temperature taken. We ask you a series of questions, if you've had any recent travel out of the country, if you're feeling sick, things of that nature, just, pretty simple questions. If anybody screens positive for that, we recommend that, it's not, safe for us to further expose you or you to expose us in order to, further spread the virus. So we'll refer you back to your primary and tell you, the current recommendations are not, to go straight to the ER or to an urgent care. It's to get evaluated to make sure it's not something else.
Right.
The other precautions we are taking is, if we do have anybody that we're concerned has the virus, if it's not an emergent thing, we're not letting them in our office. We're not an ER, we're not a hospital. I mean, obviously those places have to admit those patients, but we're trying to stay as clean as possible. We are, cleaning down, every surface, doorknobs, countertops, literally everything we possibly can, every hour on the hour, if not more. And we're also screening our staff every day. So we're taking as many precautions as we possibly can. We're obviously washing our hands 100 times a day. You can probably see the redness in my hands already, and it's time to use them.
My hands are on the screen.
Right, yeah. But we're taking every precaution we can. I mean, I have a 4-month-old at home, and I still, it's in the back of my mind. I don't want to take it home to him. So we're trying to, practice what we preach.
Good. So right now, obviously, with everything going on, with all of the efforts that we inside of the practice are taking to really just to use the coin term, flatten the curve. What are some of those things that now that we're at home that we can that we can do to still take care of our feet, to take care of those ankles, because most of us are now that are not used to sitting at a desk all day are, guess what, sitting at a desk or sitting at their kitchen table all day long.
Sure, it's actually a great question. And I get it fairly often, especially when you're stuck at home. First, if you have a lot of hardwood floors, a lot of people when they're home, don't wear shoes, or they're just wearing their socks. And without that support, we'll see an increase in heel pain. We'll see an increase in pain in the balls of your feet, just because you're not used to walking around without any kind of shoes or cushions or things like that. So a lot of times, where we start is, making sure that if you are walking barefoot at home, you're wearing some good supportive shoe gear. If you are sitting for long periods of time, it's important to get up and get moving around. It's not just good for your feet; it's good for your emotional health. It's good for your overall health to get up and, even if it's just a quick stretch or a quick rock around the kitchen to get a glass of water, we got to, keep moving. But that's just kind of good recommendations for any office job.
Yeah. It's tough too, especially when there's kids and when there's families involved, and you're still have to obviously get the job done. So it's definitely been an adjustment for a lot of people.
And we know that all too well with the newborn at home. I know my wife's trying to work at home, and my mother-in-law is taking care of the little guy during the day, and she was just messaging me today about I can hear him crying upstairs in the nursery, and it's taken every ounce of my being not to run up there and go take care of him, but I'm going to let her do her thing and continue with my calls. But it's a trying time, and the tough part is, we're hoping to see, some flattening of the curve within the next couple of weeks, or at least seeing the peak of this, but we haven't seen it yet. And we're getting daily updates from, the hospitals in our area. I mean, the nice thing is I'm actually at the Cary office right now. So the closest hospital is Good Shepherd. They do have a few cases, but, it's nowhere near what Advocate Christ downtown is seeing, or some of the other systems. But, there are surge plans and things like that, and, expansion of ICUs just in case. So, there are constantly, daily discussions going on for what if this and what if that, and just to be prepared, because the last thing we want to do is get blindsided. And we're even talking about starting to use cloth masks in the hospital to conserve protective equipment for some of the physicians, and they can go home and clean them and things of that nature. So, there's a lot of discussions that are being held to keep everybody safe.
Right. So with that with that kind of being out there, for the general public, right? So we are obviously getting bombarded from every news platform, every non-news platform about what's happening in the world right now. Where would be where outside of the ones that we're told, like CDC's website and stuff like that, where would be good resources for our patient base to keep a lookout outside of obviously our social media as we make regular updates and so on and so forth?
Sure, it's a great question. So, the places that I go to for good information, and they're updating it daily. Both Advocate and Northwestern both have public links on their websites, and it's right on the main site. You just all you have to do is Google, Advocate Healthcare or Northwestern Medicine, and it'll take you to their main site, and they have pop-ups for the COVID-19 updates, and they've made it all public. It's not just doctors and nurses that have access to it. So you'll be able to see the current treatment plans. I know Northwestern has a couple of clinical trials that are going on for drugs that are unique, that other health systems aren't performing right now, and the treatment plans are evolving every day. I just saw. It's very, very rare to see a pediatric patient or a younger patient come down with this disease, but it does happen. So there are new guidelines that I saw today for some of the pediatric treatment in the hospital and things of that nature. So, the statistics that you see are getting updated daily. It's a ever evolving. So, if I gave you a statistic right now, it'd probably change in a few hours.
By the time you got done saying it.
Right.
Yeah.
But, I think that there are a lot of good resources out there, but I'm mostly going to the hospitals in our area because, you can go to the CDC and that's the kind of more broad, but the local hospitals will at least have the current numbers and what we're doing in our area and what to expect, where to go if you have symptoms and things of that nature, which is, I think, on a lot of people's minds.
I believe it's on a lot of people's minds, which is another reason why we're doing this particular video today, which is another reason why, we're going to be doing these types of videos regularly because we really, as I'm looking at this from being on the marketing side of this organization, the biggest thing that we can do as an organization right now is be there for our patients. And in the ways that, a lot of you guys have seen some of the verbiage that we're using on the posts where we're open for you in the best way for you. So that being said, what are some of, outside of obviously still remaining open in each of our locations, and actually just added a new location, I heard as well.
Yeah, that's right. That happened yesterday.
So, crazy times right now. Mm-hmm. Anyway, so what are some of those alternate ways that we are open?
So we are currently, we expanded our ability to have telemedicine visits. So basically, we have a few different platforms that we can use. We can use either video, and there's a couple of different ways that we can do it. We can do it either through FaceTime. We can do it through Skype in some situations. We can do it through a couple of the healthcare apps out there that allow for video. We even have an app that if you're somebody that isn't as technology inclined, we can even do a text message visit that actually is approved through insurance to even do that. Wow. If you want to just have a quick check-in, that's a good option. You don't want to figure out on how to set up the webcam, but it does work. Every insurance is covering some form of telehealth visit. So if you're unsure what your insurance covers, we can go over that with you. I know the requirements for Blue Cross are different than Medicare, different from the Uniteds and Aetnas and Cignas of the world. But for the most part, they're kind of opening their doors in this trying time and kind of allowing for, whatever visit we can do. If you've got something that needs to be addressed and you don't want to come into the office, I totally understand that. And, we're not to, coin the phrase too much, but we are here for you. If you can avoid exposure, so be it. But we are still open for, obviously acute traumas, infections. We do see wounds at some of the locations, and obviously our post-operative patients or our surgeries that were performed before all this started. We are continuing to see them as well. So we are still open. If you have a new injury or something else comes up, then you're in a lot of pain and you need to be seen. But we're telling people that are higher risk to, stay home and be safe, and we can do a telemedicine visit, a video chat, or a text message visit, or if it can wait until this slowdown is lifted, we're recommending that. But we are open if you need us.
Awesome. I mean, as a non-medical person, for me to know that there are, I mean, because I try to be a bit of an athlete. Like I went out and did a couple-mile run last night, which was weird because most of my neighborhood was actually out.
Mm-hmm.
Like I've seen people in years. It was great, but it's like it's good for me to know. I mean, outside of working for the practice, it's good to know that there's individuals around and practices around that are still taking care of those. If I went out on a run and twisted my ankle, where would I go? And now that I have a place, and I commend you, I commend Dr. McEnany, I commend the entire staff for not only staying vigilant right now, but for also staying open throughout this process. Because then I've heard of other practices that have completely shut down or have drastically changed. Let's see.
Yeah, I think that's a good point. I mean, I think I hope that most of us got into healthcare to help people, and I know that I have and most of my partners have volunteered, if necessary, to expand our ability to help people in this time. I know that I'm actually on the board for the Illinois Podiatric Medical Association, and we did draft a letter to the to legislators in Springfield, requesting a temporary expansion in our scope. I know our nurses and our nurse practitioners, and we're running into a shortage of healthcare providers.
Right.
And with the training that we got with the 4 years of medical school and the minimum of 3 years of a surgical residency, we go through anesthesia, we go through every other specialty, and every one of us has put in ventilators and done those types of things and taken care of the very sick patients on the floor throughout our training. So we're drafting a letter so that if necessary, and we do have a shortage of people that we can help, and that's important to us.
I mean, I want to applaud all of you for that, because that's putting yourself in the quote unquote line of fire, and that's great to hear. I think all of the patients and our audience that hear that know that. I mean, that just further solidifies the fact that you are there for them, and that no matter what, it's their care and their health that comes first. Obviously, we have to take care of our own, but it's theirs that comes first.
Absolutely.
Let's see. So I know we've only got a few minutes left before, and thank you so much for the time that you've given this morning. Right now, I mean, I don't want to take up too much more of your time, but what would be some of those, maybe the unexpected tips or tricks that those who are at home, those who maybe are experiencing some level of acute pain or trauma to a specific area, but maybe and I don't want to get too much into like the telehealth side of things, but what are some of those quick ways to, all right, I rolled my ankle. How do I know that it's not sprained, broken before calling you?
It's a great question. It's tough to tell if you do have an acute injury without an X-ray. If you do have a large amount of pain, whether it's broken or not. But there are guidelines out there. Like if, for example, you mentioned ankle sprain. If you do have pain directly on the bone, then the guidelines are throughout the medical world in the U.S. to have an X-ray to make sure that you don't have a fracture. If you don't have direct pain on the bone, you could have an acute, ligament strain or tear. If you're worried about it, if you're unable to bear weight, then usually we do recommend you come into the office, and we make sure that, there's no break or there's no tear in the ligament. As far as, kind of typical, whether it's heel pain or whether it's, pain to the balls of your feet, or, things that we see, fairly often in the office. Usually one of the first things that we tell you to do is we show you calf stretches, and we show you hamstring stretches. And, that takes some of the pressure off of your heel and can alleviate the pain. We talk about good arch support, and, you can always ice if you've got, an acute injury, or if you've got some pain going on. And, if the stretching and the activity modification and, things like that don't work, then, we're obviously still here for you even in this time to take a look at it. But, a lot of things we tell you to start with first are, try stretching your calf, whether it's, dropping the heel off a stair, or using a towel and putting around your toes and pulling up. You can get a good stretch, and a lot of times that will help your plantar fasciitis pain, which is, probably the cause of 90% of heel pain. Things like that. And avoiding going barefoot is another key one that a lot of people don't think about. We're starting to get into the time when the weather's getting a little nicer. People will get outside with their flip-flops, and, a lot of people don't realize that flip-flops are the same as going barefoot. You don't have any support. So we'll see a spike in, plantar fasciitis and heel pain, so things of that nature. But, I think it just depends on what's going on. But we, even if you don't want to come into the office, we do have multiple people that are able to, we have nurses that can triage your call and give you recommendations. And, if you want, we can talk to you as well. The doctors can. So
Awesome.
We're happy to answer any questions you have.
By the way, I feel like right after this call is done, that I'm going to go back upstairs and put on shoes. Because
There you go.
I was feeling mildly judged.
Yeah.
A little guilty, but
If you don't have pain, it's okay. Not everybody has to do it, but if you hit a certain point in your life when people don't really think about your foot actually gets a little longer and your arch collapses the older you get. We all get a little bit more arthritis the older we get, and what worked when we were in our teens and our 20s doesn't necessarily work anymore.
Yeah.
But it's just good overall tips for health. But I practice what I preach too. I used to be a marathon and triathlon coach and athlete, and you name it, I probably had it below the knee, and including plantar fasciitis. And if I'm standing up in the OR, doing surgery in a long case on concrete, I'll start to feel it, especially if I'm home. I can't go barefoot either. So I feel everyone's pain.
So this is a personal question, only because I've been getting more and more into running over the last couple of years, and now I have your captured attention. So
Great.
This is something I get constantly now. Thankfully, I've gotten a newer set of running shoes. I went out and got a pair of Brooks Ghost 12. But no matter what I do, no matter stretching, no matter proper hydration, one way or the other, I cannot avoid shin splints.
Okay. Remember when I told you that I've experienced everything? I experienced that too. And I had it for years. So shin splints is a little bit more of a, and forgive the vernacular, we call it almost like a garbage type term, meaning that there are a lot of things that people speak as shin splints. Probably the most common is something called medial tibial stress syndrome, where you're not actually getting a stress fracture, but you are, having pinpoint pain to the shin bone, to the tibia. It's usually caused by abnormal pronation forces, meaning that when you run, your arch is collapsing too quickly, and your tibia actually takes the brunt of that force. So a lot of times we'll start with something as simple as a compression sleeve for the lower leg. I know that helped me a great deal, and I do see that helping my patients. The people that are runners that experience that and just have trouble getting rid of it, a lot of times we'll also look at custom orthotics that minimize the abnormal forces that translate up through the tibia and kind of force you to run a little bit more normal. it's really tough in physical therapy to kind of retrain your gait and retrain your running. I know that when I was a college athlete, they tried to do that with me. It didn't really work out very well. I was never an efficient runner. I just enjoyed doing it. So I literally have felt your pain. But yeah, usually we go with compression sleeves, whether it's a compression sock that basically limits the micro tearing of the muscle off the bone, and also increases blood flow and gives you a little bit more stability. And then we really consider custom orthotics because it can control your running stride. So those two things usually help. And then sometimes we consider some physical therapy for advanced cases. But yeah, how long have you been dealing with it?
I really started heavily getting into running about last year. I did okay in 2018, but I did just about 300 miles between between April and October last year.
Okay.
So
decent amount. Yeah.
Yeah. So
the other thing to think of too is always think of the type of running surface that you're running on.
Outside.
Yeah. If you're on concrete and you're running on concrete, try to limit some of that, some of the running that's on the unforgiving surface, and maybe find a local high school running track, or find a gravel path instead of the concrete sidewalk. And I know there are lots of running trails and things like that. Go off road. That actually help the shin splints too.
I'm thankful to live in a neighborhood where I can run 5 miles in the neighborhood and never leave the neighborhood.
That's really nice. That's really nice and rare.
No, anyway, I had always just been curious, and I figured since you captured attention, I would put you on the spot and ask you that question.
That's one that's near and dear to my heart. I dealt with that for a few years.
And that was another reason why I asked. I'm like, all right, he's dealt with it before. He knows what's going on. Dr. Lovato, thank you so much for your time this morning. I appreciate you taking the time to do this. I know you've got a busy day ahead of you, and for me, I think I think that this is something that we're going to continue in the practice. Feature different doctors every week, every couple of weeks, depending on obviously schedules. As again, just to reinforce to our community that we are here for them, and that we want to answer obviously medically specific questions during this particular time in this format. So thank you all so much for tuning in. Thank you, Dr. Lovato, for joining me this morning. And any last one-liner, quick words of wisdom for everybody who's watching and listening at home?
No, just be safe, wash your hands, and keep paying attention to the social distancing, 6 feet apart. I know, we were just talking about it on the call this morning, and San Francisco is finally just starting to see the benefits of it. We're finally seeing a flattening of the curve in San Francisco, and they had locked down a little earlier than we did, and just stay positive, and this may last a little while longer, but it's for the good. And as long as everybody stays vigilant, we'll get through this.
Awesome. Thank you so much, Dr. Lovato. Thank you everybody for tuning in, and we'll see you guys in the next one.
Thank you.